Welcome back to We Are Austin. February is Heart Health Month, and it's the perfect time to try and truly understand heart health and the risk for heart disease. Here to talk to us this morning is Solano, pharmacist, certified clinical nutritionist, and owner of PDLabs, a specialty pharmacy. Welcome, Ray.
Well, hello there. Thank you for having us on today.
Thanks for being here. Why do you think, besides just being a month where we're all talking about it, that this is a good time to draw awareness to heart health?
Well, you know, we think heart health is such a preventable condition because it's still the #1 killer today in our society. But, you know, if people are awareness of the things that they can do to really improve their heart health, and, you know, there's some very simple choices that people can make in their daily lifestyle that can really reverse some of these conditions. Because, you know what, 10 years from now, you would wish that you made some choices early on. And it's just some simple dietary changes, that's all.
So I'm really looking forward to this conversation. One of the big reasons is because sometimes things are so simple, we overlook them. We think, oh, it couldn't just be that easy. And so what it seems like it really takes is repetition and continuing to draw attention to it so that we do start to incorporate those simple shifts in our everyday life. So what do you think those are?
Well, when people need to understand what goes on for the foods you eat is connected to your heart health. So this gut connection is so important. But blood sugar levels and these spikes in blood sugar levels is also causes this insulin resistance, pre-diabetes we hear, but also is inflammation. So what people, you know, we went to a conference this last weekend. We asked everybody, all these health professionals, do you know what your fasting blood sugar levels are? And only about 3 of these health professionals, do you know what your fasting blood sugar levels are? And only about 3% of the people even know what their blood sugar levels are. So just that simple, easy test that we should know that this can be for people with high risk levels, people who have obesity. You know, spikes in blood and also insulin is a huge risk factor for cardiovascular health.
Okay, good to know. What about in terms of, so there you're talking a little bit about testing and knowing the numbers. What about foods that we should up the intake of or avoid to improve our blood sugar and overall health? I know for me, for instance, over the last couple of years, I've really tried to transition into more natural sugar sources like maple or agave, but there's still a lot of sugar there. So what do you think is important to know?
Well, it's important. The first meal that you have in the morning will set the stage for your blood sugars for the rest of the day. So you want your proteins and your healthy fats in the morning and your carbohydrates in the evening. So starting out with a healthy shake, I like protein shakes that have no low sugar or no sugar, that are plant-based. They could be pea protein based, that are really nice to be able to start out your day. You can add some walnuts and things, especially fiber. So it's really important to have that combination to start out your day with low blood sugars first thing in the morning. That means no Pop-Tarts and no donuts.
So, and I imagine you're encouraging that because what happens is if you start the day with that, then not only do you, you don't feel full, you get hungry again sooner, and then you crave sugar almost all day.
That's right. One thing that I tell people, if you're hungry 2 hours after that first meal in the morning, you ate too many carbohydrates, you ate too much sugar.
Interesting.
And so you have to really use that as a self-awareness for also to change that diet. So if you're really hungry after a meal, I think you did something wrong. So that's an easy tip to change things up.
What other tips do you have?
I also have people to realize that fiber, we have to get over 40 grams of fiber a day to really give that good gut health for your body, to make these good bacteria that can digest some of those red meats that we eat. You know, because it seems like Texas, we love our barbecue, we love our red meats, but you know, sometimes the way that we digest these enzymes that we have can cause this inflammation. So to make it very simple, you know, good bacteria, and also get your lab test done and see if you have these risk levels. It's really important to measure these to get those risk levels down.
In terms of giving people like practical steps as it relates to food in their daily lives, when you said high fiber, are there foods you would encourage to get more fiber, like avocado, for instance, or what do you say?
Well, I like vegetables, green vegetables, roasted vegetables. I love asparagus. I love broccoli. These are items that have a tremendous amount of phytochemicals in there that they reduce the amount, not only your insulin levels, but they also stop the inflammation. So sometimes, when people, they say, well, I don't like this vegetable. Sometimes mix them together, and I just like roasting them with seasonings.
Yeah.
And you'll be surprised how often people will choose those, even kids, to give them those choices. So it's important to add those to every meal, and you'll be surprised. You may lose a few pounds, too.
Well, and you make it fun. I call it my rainbow roast, and I just put all these vegetables on a big baking sheet that are all different colors, and it is. Whenever I put it on the table for my family and friends, it's always gone by the end of the meal. So you got to give people options. I appreciate that. You have a special kind of pharmacy. What makes y'all so unique?
Well, we've focus on the patient's health and nutrition. We're a specialty pharmacy. We do specialty compounded medications for patients, but we actually fuse this together with natural medicine many times in our prescriptions. And we also offer nutritional products on our store, PDLabsRx.com, especially our OptiMeal shakes. Our OptiMeal shakes are perfect for kids and teens and for people to get those blood sugars stable for the whole day. And also, guess what? We offer free advice. We do specialty medications like low-dose naltrexone. So we give those people some choices in their health care. So give us a call. Our phone number is 512-219-0724. And, I usually answer the phone and give some people some free health tips.
Okay, good to know. I'm going to give you a call soon, Ray. I appreciate it. Have a great day, and I hope you enjoy this month. Thanks for equipping us with these tools and that knowledge.
Well, thanks again. Appreciate it.